Have you ever felt unsafe when providing medical assistance? Have you ever experienced threats or been verbally abused at work? Have you ever been physically attacked while doing your job? Has anyone ever stopped you from carrying out your duties? Then you're not alone. My name is Anna and I work for the Norwegian Red Cross, and I have a background in emergency nursing. I work with disaster preparedness and emergency response, and my focus is on how to better prepare health workers to deal with consequences of violence that they are exposed to. Violence and threatening behaviour against healthcare workers have become a worrying global trend. They occur not only where there is an armed conflict, but also in countries at peace. Every day, healthcare personnel are facing violence as they carry out their daily work. They might be verbally threatened, physically assaulted, even murdered. When health services are hindered or attacked, people are deprived of vital care. Violence against doctors, nurses, paramedics disrupt the healthcare system when people need it the most. As the main focus for health workers is always to save lives, you may feel a sense of contradiction between this duty to help and putting your own safety first. But preparing for situations where your team is under threat or attack should be a priority. So being aware that you may enter a situation where you do not have the full overview will in itself help you to meet any challenges as safely and effectively as possible. This is why the Norwegian Red Cross looked for existing training and guidance on how to deal with violence against healthcare personnel. What we found missing was a low-threshold tool that can be used in any context to prevent and reduce threats and violence. Therefore, we decided to develop such a tool ourselves. So, a training manual for ambulance and pre-hospital response in risk situations was created. We call it TARRS. TARRS will provide a more complete approach to help health workers increase their resilience in the face of risks they encounter at work. It will help pre-hospital personnel to reflect on how to reduce risk. It builds on and is complementary to a number of already existing approaches. And it has been developed to help us be better prepared when we are exposed to risk situations. TARRS is relevant to pre-hospital personnel in operational services worldwide. The training focuses on risk awareness and on the role of pre-hospital personnel in preventing or reducing security incidents before, during and after the delivery of healthcare. Through workshops, you will develop a basic set of informed recommendations on how to deliver services more securely. It is really important that the training is tailored to your own context and of course to current procedures for mitigating risks. Another central aspect is individual protective behaviour, and the training highlights the active role we ourselves can play in reducing situations of threats and violence against us. Throughout the training, you are also encouraged to share your experiences and knowledge so that we can learn from each other. TARRS equips ambulance and pre-hospital personnel with practical skills to improve the management of security risks. It further provides a starting point for organizations for reviewing and strengthening existing procedures for emergency preparedness and security management. Our work is important, and we know that threats and violence against healthcare happens anywhere and in all forms. We must therefore continue to strive for better protection and safer access to healthcare for all of us. Before I finish, I want to emphasize it is through our daily work that we create trust and acceptance in the communities we operate in. So, when disaster strikes, we can respond in a secure and protective way for ourselves and for those we will help. Thank you for your time. I would love to hear from you, so please don't hesitate to get in touch if you have any questions, want a discussion, or just a quick chat. Thank you.